My life took a complete derailment. I was so dizzy that I was running into walls. I was getting chronic migraines where I had to step out of lecture. It was really hard.
The majority of our patients have come here after seeing approximately 10 to 15 physicians that have not been able to help them. They come with a variety of symptoms, and it turns out to be most often a connective tissue disorder like hypermobile Ehlers-Danlos syndrome. Dysautonomia comes with that.
For many months and almost, I will say years, I was feeling very fatigued, with a heavy headache, was not myself at all.
Autonomic dysfunction is a bigger problem than we know. Doctors don't really know what they don't know because they don't see it, they don't understand it.
I was always dealing with chronic fatigue, and I was always on Google thinking I had overtraining syndrome or rhabdomyolysis. And after getting blood work done and numbers being perfect on paper, I said to myself, there has to be something else.
I persisted. I kept going to different doctors, trying to figure out. I jumped to different specialties, seeing if they could provide different insight.
Physicians are really not trained in autonomic dysfunction disorders in their medical education. I got a viral infection and developed 9 months of what we call orthostatic intolerance, dizziness, unable to stand long periods of time with brain fog and fatigue, which was a post-viral sequelae. I started studying the autonomic nervous system in more detail.
What I like when I see autonomic patients is that the day they're seen, they walk out with a diagnosis, finally. And these guys could be 15 years walking around seeing 10, 15 specialists, doctors, nurses, anybody, and not have a diagnosis. And finally, after 15 years, somebody actually says, you have this, and this is how we can treat it.
Here, when you come with autonomic dysfunction, we will test and stress your autonomics to see where you are and what really is going on.
I realized I did have some dysautonomia, and he's helped me tremendously thus far, incorporating more of these supplements, alpha-lipoic acid, beetroot, nitric oxide. They have helped me feel 10 times better.
It feels good to be a fully functioning human being again.
We help them get their life back.
The whole point of treatment of autonomic dysfunction is to give back somebody's life, to let them go back into society, to let them go back to work, to let them function again.
The autonomic nervous system connects all the organ systems together. If there's an imbalance, they can affect multiple organs and cause multiple symptoms. We can do appropriate testing and identify where the problems might be. Once we know that, we can even direct therapy more targeted. The results are much better and much quicker attained in terms of improvements.
Our medications are temporary. They're temporary until we stabilize them. And once they know that these are not lifetime medications, there's relief in that.
The dosages that are being used are very low in potency, which is good for the patient. A lot of these things are not even prescription medicines.
From my experience working here, patients do absolutely improve.
We can diagnose them that it's not in their heads, it's not anxiety. We can treat them, and we can see excellent results with resolution of the symptoms.
Most of the patients break down and cry because they have validation that something is not right. They have a diagnosis. It's treatable. It's not lethal, but they're able to get their life back.